Should I worry about general anesthesia for a lung biopsy? When facing a lung biopsy, it's natural to wonder about the safety of anesthesia. General anesthesia is often used during more invasive procedures like open or thoracoscopic lung biopsies. It helps you stay completely asleep and pain-free, making the procedure smoother for both you and your medical team. But like any medical intervention, it does carry some risks that are important to understand. The main concerns with general anesthesia involve breathing difficulties, reactions to anesthesia medications, and the chance of complications such as pneumonia or airway problems. If you have existing lung issues or other health conditions, your risk might be higher. Anesthesia can temporarily affect lung function, which might increase the chance of lung collapse, known as pneumothorax, or infections after the procedure. Some patients also report sore throat or discomfort from the breathing tube used during anesthesia, but these symptoms usually resolve quickly. It's important to remember that the risks associated with the biopsy itself, like bleeding, infection, or pain, are generally low. When anesthesia is added, these risks can increase slightly but are usually well managed with careful monitoring and medical care. For less invasive options like needle biopsies or transbronchial biopsies, local anesthesia or sedation might be enough, reducing some anesthesia-related risks. However, for more complex or invasive biopsies, general anesthesia often provides the safest and most comfortable experience. In some specialized centers, doctors are exploring alternatives such as regional anesthesia or non-intubated techniques, especially for elderly or frail patients. These methods aim to lower anesthesia risks while still allowing the doctors to get the tissue samples needed. Still, these approaches are not yet standard everywhere and depend on the expertise of the medical team. Overall, while general anesthesia does carry some risks, they are generally low and carefully managed by your healthcare team. The benefits of obtaining an accurate diagnosis, whether for lung cancer or other lung conditions, usually outweigh these risks. It's very important to discuss your personal health, lung function, and any concerns with your doctor before the procedure. They can help you understand your specific risks and how they will be minimized. Be sure to follow all pre- and post-procedure instructions and report any symptoms like fever, chest pain, difficulty breathing, or bleeding immediately. Rest assured, your medical team will monitor you closely during recovery to keep you safe and address any issues promptly.